Sometimes life is unpredictable. Suddenly you're on a journey you didn't plan for and didn't want to go on in the first place. My name is Etienne Crevier, and this is my life story. At a very young age, my life plan was already set. I studied to become a genetics researcher. I wanted to help people find new ways to stay healthy. My dad was a big inspiration for me. He was a family doctor who helped thousands of people. He lived a healthy life. He didn't smoke, he didn't drink. He was in excellent shape. Despite all of that, my father had a heart attack. He was given a drug to prevent further complications, and even though the medication was supposed to help, he soon suffered a second heart attack. And this time, it was fatal. I studied biochemistry and genetics. I know that two people can often react completely differently to the same medication because of their DNA. It can take one person 2 weeks to respond to a medication for depression or arthritis, for example, and yet someone else can suffer for months taking the same pills. Our genetics influence not only the ideal dosage, side effects, and effectiveness of a medication, but it can also predict whether what you ingest is safe or potentially very dangerous for you. Today, we have a greater understanding of the impact genetics can have on the risks we can't control, as well as the changes we can make to reduce those risks. What if you love coffee? Wouldn't you want to know if it made you more susceptible to heart disease or if it could help you avoid heart problems? And if you were looking for the right ADHD treatment for your child, wouldn't you want to know the best option right away? I spent a year and a half recruiting specialists, and we worked around the clock to make our vision for a more informed healthcare a reality. With the right people in place, and my determination to make genetic information accessible to anyone, I started Biogenic. We are a dedicated team, and we have helped thousands of people understand their DNA. It's almost certain that a detailed test like ours will reveal at least one recommendation that can make a difference for your health. And that is one fact I wish I knew before my dad passed away. My name is Etienne Crevier, and if we had known my dad's DNA, well, let's just say that his path and mine might have been very different.
Thank you very much, Benoit. I'm very happy to join you here today for this presentation on pharmacogenetics. Let's be honest, it's not going to be that much of a science background. We're really going to aim on what's the benefit for any HR's department in any company across Canada. So Biogenic, we're really proud and happy to be partners with SSQ. And as you saw on the video, I was not aiming on an entrepreneur career. I was really aiming to be a PI in a university, have my own lab, and to go do my postdoctorate somewhere like in Boston, and then have a very stable job. But things turned out very different for me, and I was not very prepared to found Biogenic, which is one of the largest genetic laboratory now in Canada. But now I was not aiming to be in the insurance technology field, but I'm going to explain to you how really genetics can improve the life of any employee, especially in these circumstances that we have faces right now with COVID-19. I think it would be very deceptive to not focus on that, what we are going through right now, since the coronavirus is really impacting any companies and any flow through any operations that we have right now in our organization. So I would like to just start with these little statistics that we have on a survey that was performed at the end of March, because the situation evolves weekly and weekly at a rate that hasn't been seen. I mean, we saw that the percentage of people who feel stress and anxiety caused by the coronavirus is increasing at every week from a rate that we haven't seen. And sadly, it's impacting more women than men, and especially parents with children under 18 at home. So I think anyone that has children at home can comment that it's not been a very pleasant period, and it's very hard to be able to focus on work when you have to take care of your child. But I think what we're going to see is a very negative impact on mental health, because right now, any employee that is at home is kind of really resilient on what we're facing right now. it's a situation where we were told to just hanging there. It was not going to be easy, but we're going to, get through it. And after it was going to be really, we're going to ease the way, and we're going to be able to reopen, the businesses, and get back to a kind of a normal life. And it's happening right now. So we see it, across the world, that any countries are kind of really reopening and really, loosening on the laws on the social distanciation that were, implemented. And so it's the resilience that any employee had to take upon their back is really going to, get lifted up. And we're going to start to see the signs of mental health problems, troubles impacting the workforce that we have in our companies, because we were kind of putting an armor to say, okay, let's go through this all together. It's not going to be easy, but once it's done, it's going to be done, and we're going to be done for good. And now we're talking about second wave, but really the resilience part, the armor is starting to lift up, and we will see the impact that any organization will have to face, and we'll see the bill at the end of the month based on that. So the first pandemic is almost going to an end for the first wave, at least. But now the second pandemic, which is the mental health pandemic, is really going to start. So another survey that was done by McKinsey company at the end of the month of March showed that about 80% of the population have experienced distress due to COVID-19. So either it's high distress or moderate distress. People on all respondent felt that they've, had some sort of anxiety or depression because of what was happening. And especially these numbers are increased by almost 90% of people felt distress when they felt reduced hours or job loss. So we cannot commit to say that everything's going to be back to normal and real normal when we reopen and every employee come back to work, especially if a company had to lay off even temporarily some people because reduced hours impacted the budget, and people will now be less resilient and have to face this situation where, we will see some really mental health trouble impacting the workforce and every organization. So it's really interesting when we also compared on the consumption rate of either alcohol or substance abuse or illicit drug, because there's an increase on that as well since COVID-19. So we don't see it as much on the collective insurance part, or we don't see, the impact of that, because usually it comes after 4, 5, or 6 months after starting consuming. But there's really people who admit 1 in 4, 1 in 5, who now are taking either more alcohol or prescription drugs for a non-medical reason, which means that they're taking medication without a script, and just to probably ease the distress that they faced and now they have going on in their life because of what we're going through, which is an unseen circumstances. So we all know that we were experiencing an increase in every organization. So every of your client or any of our client was seeing an increase into the short-term disability due to mental health. But now it's going to be more and more important to face that and to address that in our organization, since about what we've been through and what we saw recently. So, like I mentioned, in the year 2000, it was 6.3 person that were, of the whole workforce who were taking time off because of short-term disability. Either it's pain related, either it's mental health, either it's cancer. But overall 6.3. Now it's 9.7 in 2016 in Quebec, and in 2019 the number of Canada, it's around 11.3% of the whole workforce who are facing absenteeism. So it's a real increases, and management and HR department are seeing more and more insatisfaction from the workforce, because the collective insurance, the prices are getting higher. It's more and more difficult to add more value added services. I think every company wants to see their employer brand better recognize and want to attract better talent, but we are seeing what we see, which is an increase on the short-term disability. And even when we see it was 8 days a year in average per employee per year in a company that was taking time off. Now in 2016, it's more around 10, 12 days. So if we consider that mental health account for between 30 to 50% of the reason why of the short-term disability, we can easily say that it's around 6 to 7 days per year that it's really related to mental health, causes that we're facing. And it's going to be interesting to monitor that in the near future, especially with what we've been through. And like I mentioned, the resilience that any employee had to put on to face COVID-19 crisis and the pandemic. So if we were in a large room to give this conference in a normal setup, I would have asked who is aware of what your blood type is. And about 70% of all of you would have raised a hand and say, yeah, I know what my blood type is. And then I would have asked you, those people who are aware of your blood type, who would accept a transfusion that is not compatible with your blood type? And about everybody would have put their hand down saying, I don't want to have, an incompatible blood type. So the same process applies with your genetics and your medication. If your genes are not able to metabolize and respond properly to a drug, why would you accept to receive that drug? If you're allergic to penicillin, why do you accept to take penicillin? We will not. And so in the near future, in about 10 years, 5 years from now, I'm, betting on whatever you want that we will not prescribe a drug that is not compatible with our genetic testing that we are, currently seeing an increase. It's this precision medicine, the personalized medicine revolution. And I know there's always, 1%, 1.2% of the room that would have said, haha, I'm AB plus blood type. So I'm the universal receiver. So I can receive any blood type that I want. And that's true. Yeah. And the same process applies with genes and genetics. So there's a percentage of the population that can take any drugs that they want. They can take any nutrients and eat whatever they want without, facing any, consequences or because it's compatible with their metabolism. But compared with the AB plus, which is 1.2% of the population, the people who are in the normal range for genes is 0.001% of the population. So it's basically abnormal to be normal, considering your genetics. And now it's more and more true because saying that I'm going to practice medicine, saying, okay, I have in front of me a Caucasian female about 35, 40 years old. I should, this drug should work and I will prescribe this. Any physician will tell you it's not how it works anymore. The statistics approach is over. Now it's a complete change of paradigm in the sphere of healthcare because we are treating everybody the way that they are because of their genotype, because of their genes. It's the precision personalized medicine revolution that Obama was talking about in 2010. And anybody who are born in Quebec or in Canada and have more than 6 generations of ancestors from Canada will have, Native American genes in their system. So because there's really more, cultural crossings and we have more and more different background, then what we're seeing is some big change and big difference in the way that we have to practice and we have to assume that the patient we have in front of us is completely different. If you take me, for example, I'm ginger. I'm probably from north of Europe, France as ancestors, but my ancestry profile tells me that I have, Native American genes in my system, and I also have Irish and Italian, genes. It's very I don't want to get too much into the ancestry aspect of the genotype because it's more fun and easy and very medical, has a medical use. But it's very, it tells us that we're not what we think we are anymore, and we have to be more careful when we prescribe medication. So another example that I like to give, other than the one that you saw in the video with my dad, is the one of Mr. Paul, who was 61 years old and came from a little town here in Quebec called Sherbrooke. And Mr. Allard actually, faces stage 2 cancer for, intestine. So it's really benign cancer. It's really something that was not life-threatening. He was, prescribed a drug called Xeloda just to avoid, any complication and any circumstance that would have increased or give, bad consequences of the treatment, of other chemotherapy. So before starting chemotherapy, we were giving Xeloda to that patient to just avoid. And it's well known that 5% of the whole population cannot take that drug, Xeloda. So actually it burns all the digestive tubes, and it's basically the patient dies in a very short range. And after only taking 3 doses of Xeloda, actually Mr. Allard passed away after a week and a half. And, we performed an analysis of DPYD, and it was confirmed that he was in the 5% of the population that it was basically deadly to take that drug. And it's really more, the impact of pharmacogenetics is really more deadlier when we talk about cancer, but it's as important when we talk about mental health, because basically we die at a slow rate when we have a undiagnosed or bad treated depression or anxiety trouble. And basically, I personally have ADHD with anxiety disorder triggered, and I can tell you that it personally took me 3 trial and error before finding the right drug, and over a year of trial and error. So it's really important to be able to find the right medication faster. And when we talk about side effect of medication, let me tell you, give you a small example of an average patient that we see. So let's call her Adele. Adele is a 35-year-old woman who works in a standard job, office desk job. And basically the workload is just adding and adding. People are leaving for vacation, and so she has more and more workload, and she starts to have some depression symptoms. So basically she's really, really tired, has less patience with kids or even colleagues. And so, it's advised that she go see her doctor and just talk about it. So after, when she goes see her doctor, basically she tells, well, I start to feel really depressed. It's not going well at work. I'm sleeping all the time, and I'm yelling at my kids. So doctors, well, okay, it seems to be really depression. So I'm going to start to just give you this drug, which is an ISRS, so which is an inhibitor of serotonin recaptase system. So it's the standard drug, the first line of drug that we give to any patients when they start to have depression symptoms, which is the guidelines of practice in psychiatry here in Canada. So Celexa 10 milligrams, for example, it falls into that category of drugs, and it's a very standard, very low dosage, just to see how the patient reacts to that specific medication, that specific drugs. And usually I would say with 10 milligrams, basically you have no side effect, but you also have no positive aspect, or no, you don't see any improvement or any increase in your mood. And usually it takes about 2 to 3 weeks to really see an impact of any new medication in depression. So the doctor says to Adele, okay, start this Celexa 10 milligrams, call me back in 3 weeks if you don't see any improvement. And usually it happens when it happens, and when you can see your doctors again after 3 weeks, because especially with COVID-19, what we see, it's more and more difficult to talk to doctors. And if you don't have telemedicine offered in your company, then it's more 5 or 6 weeks to be able to see your doctors again. So after the 3 weeks, Adele goes see back to the doctor and say, well, I don't feel good. I don't see any improvement. And so the doctors, okay, well, we're going to increase. We're going to double the dosage, so 20 milligrams or 40 milligrams. And then that's when, adverse side effects starts to kick in. So dry mouth, trouble sleeping or loss of appetite. And so she called after 4 days, she called back the doctors and say, okay, well, I don't feel good. It's not going well. I have huge side effects. And the doctor says, okay, let's stop. So she had to start for 3 weeks, first dosage. Now, after a week, she has super high side effects. So we're at 4, even 5 weeks of short-term disability in the case of adult. And any good physician or the practice, any guidelines has to tell you that if you want to start a new treatment in the case of depression, or if you want to start a new antidepressant, you have to flush the first one out of your system before you can start a second one. So it's a good flush is 2 weeks. And so we're now at 7 weeks of disability in the case of Adele before she even started a second antidepressant. And in average, it's 2.8 medication to find the right one in the case of anxiety and depression for any Canadians here that we know. This aspect costs a lot on the Canadian healthcare system in any provinces. It's 2,300,000 hospitalization annually. We're talking about 140,000 deaths annually, and it's even more death than the road and the car accident rate. It's the fourth cause of death rate in Canada. It's $3 billion in annual cost. And even the statistics for the death annually is probably undershoot if you're asking me, because if we take a patient that, for example, fell at home, fell dizzy, stumbled upon the dishwasher that was left open and knock his head, the reason of the death will be, a head concussion or head hemorrhage. But basically, the reason why did he fail at the first place, was it because of side effect of medication, adverse side effect that he took? And we're never going to know. So the numbers is probably less. Or even car accident, why the person had a car accident at the first place. Was it because he fell asleep, or was it because he started a new treatment that was, causing dizziness? So those aspects will ever felt unanswered. And so when we started Biogenic in 2013 in my basement, we wanted to know, well, if the science is as adamant and was so clear about the impact of pharmacogenetics for the patient, why was not it integrated more and more? Why it's not made available to any Canadian? And so we surveyed about 400, 500 doctors and pharmacists, and 90% of them said that if it was available, they want to have that genetic information of their patient. And it was 95% of pharmacists who was in favor of having access to that data. So we were really, kind of in a blank here, or we wanted to have, then what's wrong? Why it's not integrated? Why it's not accessible? My own dad passed away because if we had known his genetic information, things could have been really different. And basically, it was still very not accessible. It was really offered either in academia or in a pharmaceutical industry, but it was really impossible for any Canadian to have access to the blueprint of their own body easily. And then we discovered in that survey that 70% of healthcare professionals admitted that they don't know when or how to access this information. So it was not a problem of science, but mostly a problem of accessibility, of operation that genetic had to face. And so we saw an opportunity to offer a good, simple test to any Canadian, with only a saliva swab that was not needed any special, manipulation or any dry ice to ship back. So any simple envelope from Canada Post shipped at home, you spit in a tube, you return it, analyze 5 days later, you have the result, and on a secure portal. That was not, nobody was doing it at the time. So we started Biogenic with that goal of being the largest laboratory for pharmacogenetics, and which we achieved and we're really proud of. And on top of that, there was IBM with Watson, their supercomputer that analyzed. With the amount of published data, scientific data every day, just for a healthcare professional, just to be up to date in his practice, would have had to read 20 hours per day just to be up to date. So there was an overload of unstructured and published information every day that it was impossible for doctors to keep track. And so basically, if we consider the physician as a CEO of the healthcare system, we wanted to be the CTO. So bring, a structured information, bullet point, simple report to the physician, the nurse, the pharmacist, and the patient himself, because the patient has to, learn about who he is and what kind of drugs and nutrient he can take and have access to, and without harming himself. So it started with physician and patient to really bring that information alive. And the gap that we wanted to face was basically made that information really integrated. And one big roadblock that we faced was reimbursement. So in Canada, we are what we are. It's a good technology really see an uptick when insurance company like SSQ add that value to their portfolio. And so we're really pleased to see that uptick happening right now in 2020, because we're going to sit down in 10 or 15 years from now and do the same webinar. And we're going to be here and telling each other's, wow, we were there in 2020 when we first started to use genetic information in society. We were there when it first started there, to this breakthrough, because I'm telling you, in 5 years from now, everybody is going to have access to their own DNA on their phone. And it's going to be something that's probably going to be performed automatically at birth. But right now we have access to that amazing technology that really helps to decrease the cost of mental health, and we shouldn't left that untackled. So one reason that we have to tackle here is why genetic information is so powerful when we think about mental health and depression that we face in society or even in organization today. And one aspect of that, why it's a niche, and I would say the signature offer of genetics today, is the fact that we know, based on studies and epidemiology analysis, that 38% of patients will not respond favorably to SSRI antidepressant. And SSRIs are selective serotonin reuptake inhibitors, which is, like I mentioned in the case of Adele, the first line of drugs that we will give to any patient, because it's are the good practice and the guidelines of psychiatry. So we know that 1 patient out of 3, and even more than that, are going through the process of the 7, 8, 10 weeks of short-term disability, because we will start them on Celexa 10 milligrams, and it will not end up well, and they will have adverse side effects. So let's be honest to each other's. When we think about any organization, people who leave for short-term disability because of mental health are already taking, at 80% of all the cases probably, are taking antidepressant before they leave on short-term disability. So what happens is the workload had an ad, and they start to talk to their doctors, they start to take an antidepressant, and they don't see any improvement. And on top of that, they do have adverse side effect. So it just increases the burden that they feel, and then they leave and they go on short-term disability, and it's harder and harder to catch them back. So if we act before that, if we act when they are, first taking the first script, the first prescription for the antidepressant, that's where we have the biggest impact and the biggest chances of bringing them faster, and even not having to send them on short-term disability at all at the first place. And even it's 2 out of 3 patients that will not be in remission after the first treatment. And why is that? Well, 1 of 3 is because of the drugs, and probably another 32 or 35%, it's because they will not even convert the prescription when they are at the pharmacy. So it's called observance. And we know that a patient, 50% of all the scripts that are made of antidepressant are not converted, because the patient is probably there and say, okay, well, I have my script. It's good for a year. And if I'm really, really there, I will start my antidepressant, but I don't feel like, taking that drug right now. And so there's a lack of confidence. There's a lack of trust in front of their physician and their treatment. And it's well known that pharmacogenetics increase that confidence, increase that trust by 85%. when we are able to tell the patient, well, on all the drugs that we have right now available, we eliminated those who we know will not work. So please trust me, it's going to be more and more effective for you than what you think. And it's not only, I would say, pharmacogenetic is not a standalone solution. So basically, it has to be integrated with other care and the right diagnosis and a care coordination to be very effective. And so we don't know exactly what other drug that a patient takes when we perform the analysis of a genetic test. So that's what we call the DDI, the drug-drug interaction. So when we tell a patient, for example, okay, it's cool, you can take Celexa 10 milligrams, but for example, they're taking, anti-pain medication or pain medication, I would say, or cortisone, then it could impact or it could change the course of action and the treatment that the physician will prescribe to them. So it's not because we tell a patient there's no signs of adverse side effect for Celexa that it will work. This patient needs to talk to a pharmacist or a physician before really saying, yes, it's good. And that's why we integrated into the core of the test free consultation with our pharmacist internally on telemedicine consultation, because we wanted the patient to be able to understand, his result and who he is at the end, because there's nothing more personal than the genetic information itself. And so it's available to the physician, to the patient, to have access to that consultation and be able to have the optimal treatment and the plan and the recovery faster. And so after the results are available, which is 5 days after they came back to the lab, any patient can call and book an appointment with the pharmacist. And I mentioned it earlier in the presentation, we know that more and more time that it took to return to work, the likelihood of returning decreased exponentially over time. So when we reach, I think it's 26 weeks of short-term disability, the chances of a successful comeback are less than 10%. And the sooner is optimal for, the sooner we can identify which drug will work best, then we know a patient will take actions and will have better life habits and work-life balance and the potential probability of recovery are increased. So what we want is catch who are these mental health patient employees who will suffer on the long run, catch them earlier, faster, so we are not going to waste them on a long-term disability. And one big statistic that we started to monitor here at Biogenic was the shift between short-term and long-term disability and how we are able to reduce that with our technology. And it's probably by twofold. So 50% of all the long-term case disability are reduces over a span of 2 years because we're able to offer the test when the patient gets a prescription for an antidepressant and then when they fall into disability. So it's very important to have that conversation with our workforce and be able to have a better prognosis for them, basically. So it's the only science, don't stress out, that I'm going to present here today with you guys, but it's the impact of pharmacogenetics on antidepressant. And it was something that for a long time had to be quantified. And in 2013, and it was readapted in 2015, a very nice study basically took 3 different questionnaires, standardized questionnaires for depression symptoms and how improved it was. So the symptom scales and percentage was the HANDI, the QDS, and the PHQ-9 was evaluated for 50% of a population. That is, I think it was 250 patients who were just going on trial and errors. And another 50% was going to pharmacogenetic testing before starting a treatment. And basically, we're able to see that here with pharmacogenetics, there's a clear improvement, a clear fold improvement on the improvement of symptoms after the start of a first depression or mental health situation. And on top of that, if we add the 80%, 85% of increase in terms of medication, then we should reach basically a 50-fold, so a twice improvement, 2 times improvement of all the symptoms related to depression. So basically, our goal here at Biogenic was to make that available quickly and simply to any Canadian. And so with the help of SSQ, we were able to package something that was really simply made and which is accessible, shipped at the patient house, simple kit, which can be used for other stuff than only mental health. So we have ADHD profile, we have a pain profile, so chronic pain. We're able to target drug of cardiovascular diseases as well. And we have the nutrition profile, which is a more holistic approach, but is as important. And one example I like to give is the caffeine. So 50% of the population basically are fast metabolizer of caffeine. So the caffeine doesn't stay long. And those people who take coffee at 11 o'clock at night and at 12 at midnight, they just sleep like a baby. And those people who, we're all jealous of. So I'm not in that 50%, I would say. But those people basically, when they drink 3 cups of coffee per day, they keep all the good nutrients and the molecules in the caffeine who help them reduce their chances of having a heart attack by 25%. But the other 50% increases their chances by 80% or more when they drink 3 cups of coffee per day. And it's the same impact than smoking a pack of cigarettes per day, basically drinking 3 cups of coffee. And the only way to know in which 50% we are is by performing a genetic test to know how is our metabolism of caffeine, so which is included in our nutrition profile. But basically, we are able to know right now that if we would perform a genetic test on any Canadian who are taking medication at the moment, it would result about between 2.5 and 3 million people that we will confirm that they are not taking the right drugs for the right reason, basically. So we have colleagues, we have parents or friends who are currently taking drugs and going through adverse side effects and living with side effects that they don't have to, they are not forced to. And there's a solution now. We're not able to say, oh, well, yeah, I have dry mouth because of my medication, but it is what it is. It's over. We don't have to go through that anymore. We can basically have a right fitting drug. And it was a game changer in 2016 when the guidelines in psychiatry called the CANMAT here in Canada published that in the case of major depression, it is recommended to use pharmacogenetic tested when it is available. And it is available everywhere now because we are here and we are able to ship everywhere and analyze the sample of any Canadian who are going through a mental health situation and have to take a drug. And so basically, even a CANMAT, I told you it was 2 times more likely to be in remission after taking a pharmacogenetic test. But the CANMAT published it was 3.5 times. So I'm a little bit more conservative here. Our internal results show that in average, it's a 4-month duration for short-term disability because of mental illness. And after, offering the test to any, employee who are going through that situation, basically we're able to bring back, to reduce the short-term disability by 2 to 3 weeks. So it depends on the industry. It depends on, the amount of workers and if it's a remote or not place offices. So we're able to adapt, and we have enough experience with different industry to be able to adapt the process to any companies. But overall, basically, we know we're going to offer a test to people, to employees, just to confirm that the first drug was the right one. So when we say that 38% of all employees will not respond well to SSRIs, then we assume that basically 62% of them, it's fine. So they will just take the first drug and it will work. But no, actually, after surveys and after analysis, we saw that it's 50% of all the employees who go through a change of medication after performing a pharmacogenetic test. And why is that? It's because when we confirm that the SSRI is right, the physician and the patient are more confident to increase the dose faster. So instead of going through the 2, 3 weeks, 4 weeks of trial and errors, to see, just tell me if Celexa 10 milligrams works for you, then we're able to say, okay, well, the test is confirmed that you should react properly. So let's go to Celexa 40 milligrams right away. And so we have a shorter duration of trial and errors, and we reach the optimal level of the metabolite in the bloodstream faster. so the patient feels better faster. So because of that, then we are able to help about, every employee so going through that phases, and it brings really comfort, it brings confidence and trust in the process. It open a conversation about mental illness in a workforce and an organization that is really game changer. And because we are all dependent of our CFOs in our organization, and we have to justify any expenses, I'm giving you a return on investment scenario of a real company, a real cases company that is client of Biogenic, and that we analyzes over the course of 1 year. So that company had an average duration of disability leaves for 65 days, which is, I think, 16 or 17 weeks, all taken together. The average salary of the employee at the company was $300 per day, which is about $65,000 per year. And the cost of the Biogenic test on the retail price is $285. So basically, when we take it was 35% of all the workforce who was on a disability leave because of mental illness. I think it was overall 325. So it was 104 patient employees, basically. All taking into account, so 100 times 65 days times 300, it's basically $2 million at the end of the year because of disability. So if we reduce by 7 days, it was more than that, but I'm being conservative here. If we reduce the disability by 7 days and we take into account the $28,000 cost of offering the test to that 100 employees, it's still under $2 million if we have no improvement at all. But when we take that 7 days and we reduce from 65 days to 58, so we have a $240,000 yearly saving. And I remember that VP HR told me, I fear for my job for not telling that to my CFO because it was just a huge, a saving that, I had to tell them that it was available. So we all want to, help our workforce with depression. And so pharmacogenetic is not the only avenue. It's not the only thing that we can act upon. So stigmatization, misinformation, access to care. Please, if you are interested in that sphere, we're here to help. Be Home Biogenic. We can help you, put in place any program, and it's a turnkey solution. You don't need a project manager in your organization to take that into account. We are here to help. We're just implementing, and with SSQ, we're taking charge of everything. And I'm just leaving you on this, the 5 reasons to include pharmacogenetics in your company. And I will stay with Louis Régimbald to answer your questions. So don't hesitate to ask anything. We're here to help. We're here to, bring more clarity and transparency on, that science. But basically, we know that it will reduce the duration of disabilities. It will reduce the cost related to absenteeism and presenteeism in your organization. It will reduce the cost of group insurance. It has a low cost of deployment. So like I mentioned, no need to project manager. We're here. Everything is a turnkey. And it shows your employees that, you have a culture of well-being and health, and you're focused on helping them and have an open discussion about what we're going through. And it's especially relevant with what is happening with COVID-19. So please take that into consideration. And it was a pleasure. Thank you very much.
Thank you very much, Benoit. Thank you very much for the opportunity to be here. Very grateful to share with the audience a broader view on how SSQ Insurance is thinking about the digital health solutions. So the presentation we just heard from Etienne certainly is very specific, and I think it illustrates very clearly how we're looking to build these solutions going forward. And maybe just as an overview to say that as we think about our position or this approach that we're developing around digital health solutions, we're really looking at 3 components. One is ensuring that we're building our platform, or we're looking at solutions that are really built around the plan member themselves. So I'll get into detail a bit more what that means. But secondly, the solutions that we're looking at, or the partners that we're looking to work with, are really looking to meet some very specific needs. And finally, we're trying to do this fueled by meaningful collaborations. And so as a result, today I think is a very good example of what we mean by a meaningful collaboration. One of the things that we're really trying to do here with the plan members, and plan members are, we think of them as being customers. We're really wanting to help them manage their health outcomes. So I just want to put into opposition the notion of managing your health versus a broader concern around wellness. And the focus for SSQ insurance in this environment is really more around health outcomes. So, prevent issues whenever possible. And certainly Etienne alluded to that in a couple of situations, or contribute and help treat whatever issue may arise should it happen, in order to limit, if you will, the duration of the issue, or get it under control. Today, as we thought, as I mentioned, around looking for solutions that line up against some specific needs, I think that, I'm just going to underline everything that Etienne mentioned around mental health and the prevalence, if you will, of mental health issues. There are, he cited a few studies, a few surveys. We've seen other studies and surveys that show that this issue around mental health is going to probably grow within our population, our employer and employee population. And certainly, we're looking to do anything we can to support that. Some of you will have taken note of our sponsorship of the Stronger Minds program, for example, and other such programs. And so, this is obviously very top of mind. Musculoskeletal chronic disease issues are omnipresent in our the employee basis or the plan member basis. Again, these are the probably top three conditions that we're going to be looking to provide some solutions around. So how to do that? Well, as I noted, we're looking for really to develop the meaningful collaborations. And today, there are 4 partners that we are working with on an ongoing basis. We have the benefit of hearing from Etienne and Biogenic today, but we also have significant relationships with Aleo around sleep therapy, Dialogue, a telemedicine player that's expanding their role into mental health as well, and Beacon, which is Canada's leading cognitive behavioral therapy provider, certainly in a digital context. So, again, just to remind everyone that as we think about allowing plan members to benefit from the services that Biogenic have to offer, we think of it in 2 different contexts. One is, obviously, should the plan provide for this, either through a health spending account or other type of mechanisms, that the plan members who choose to have to use these services can get reimbursed according to the available coverage. In a more extreme case, should individuals choose to or want to benefit from the situation here, from the offering, and that the plan not necessarily be designed to allow them to get reimbursement, they would have access to the services at our wholesale price. And finally, I think that there's a separate case where if someone is in a disability setting or has already met certain thresholds, that cost of the test, because we believe it would be in everyone's best interest in order to have that test executed. Now, one of the things that's very important to underline here, and we can't say this often enough, is that the decision to take this test is really up to the individual. And so it's at their discretion. And the results of the test belong to them. We will never see the results of any of these tests. And in fact, they belong to them, and they are then free to share these results with their medical support, their physicians or attending physician or their family doctor, in order to be able to make best decisions going forward. Lastly, maybe just a call out as we think going forward, some of the other partnerships or ideas that we'd like to be able to to consider. You know, we would certainly be happy to hear from any of you who may have seen how examples of other solutions in the marketplace that you think would be attractive for an organization such as us. So feel free to drop a line at this email address, and more than happy to have a chat of any ideas that you may bring forward. Thank you.